Hello, I'm Mrinalini Dey, and I'm an academic rheumatology trainee based in Liverpool in the UK, and I'm reporting for ACR 2020 for Rheum Now. And today I'm delighted to be joined by Dr. Marwan Bukhari, who is Editor-in-Chief of Rheumatology, which is the official journal for the British Society for Rheumatology. So thank you for joining us today, Dr. Bukhari. So first of all, I was wondering if you could just tell us a little bit about the ways in which the journal has had to adapt due to COVID-19, for example, due to trials being put on hold and such like.
Hi, thank you very much for the opportunity to give us a chance to chat about the journal and what we've been doing throughout the pandemic. It's been an interesting time for us. The first thing that has happened is that we've had an increase of almost 150% of submissions in the year. And it's obviously been quite an interesting time because a lot of people have had some time in their hands. They might have been less busy socially as they have been in the past, and they've been putting quite a lot of papers through. There's also been a big sense of urgency in that because we don't know how COVID affects our patients with the rheumatic diseases, that there's been a lot of urgency about doing very quick studies, which might not necessarily have been thought through that well from around the world, looking at different cohorts with very small numbers rather than amalgamating patients so we can actually have meaningful figures. The journal itself, we've had problems in that we're obviously not at the meetings, we're not promoting the journal at the meetings. So currently I am sat in Lancashire rather than being in Washington at the ACR, which we're all at the convergence, but we're all sort of like chatting to each other on here. And the opportunity to look out for what's new and commission editorials and commission reviews has been a problem. For running the journal itself, we've actually been doing okay because we've got an international editorial board. And so our editorial board meetings, because they're being run remotely, we just had to be very careful in putting the timings so that it's the right time for here, across the Atlantic, in the Pacific, and in the Antipodes. And trying to get all these time zones to actually attend the same thing can be challenging. The trials have been put on hold. So we were expecting that some of the bigger trials would be coming our way and would be reported. But I think a lot of the investigators have been taken into trying to do COVID type research. And so we've had, we were expecting by now to have had quite a lot of papers coming out of some of the trials that you would have heard about in the meetings, but we're still not seeing them, and we're not seeing them in print as yet, because a lot of the publishing world really has gone to COVID, and that's all they're reporting on. This has happened in COVID. And there's been a variability in the quality of the COVID research that's been done, but we shall watch the space.
Great. And how do you think COVID-19 has had an impact on the rheumatology literature in general, particularly from what you've seen? You've touched on it a little bit.
So the COVID-19 itself has impacted because there's a perception out there that if they put COVID-19 into a paper, it suddenly becomes a much more interesting paper that will be read a bit more. And the fact of the matter is, if it's a paper that's basically been around for a while, putting COVID-19 on it won't really make it that much more interesting. And adding on, and by the way, I contacted 3 of my patients in the cohort, and 2 of them had COVID and 1 didn't, isn't really going to make, a paper that's a preliminary paper and much more publishable. Other things that have been happening is that there's been lots of hypotheses and case reports saying my patient got COVID and then developed polyarthralgia afterwards. That's very well recognized. That's not a case report. People know about long COVID. A patient developed a reactive arthritis or developed a rash after COVID. That's all been recognized and reported elsewhere. So where the increase in traffic of vignettes and case reports, especially to our journal, which takes those, has been around an order of magnitude higher. We usually reach a certain number of submissions in December, and we exceeded that by the end of June this year, just to show you what happened. So, our December intake of papers has actually happened in June, and we're now just, we're just having to battle. And it's affected our publishing times to an extent, not acceptance times, but from when we accept a paper to send it to our publishing house. They're struggling because we're outputting more papers than ever. And to get the papers from acceptance to online publication has actually lengthened slightly. And it's just due to the sheer volume of things that we're getting through. And we're trying to be, fairly fair and pragmatic, but we might have to tighten things and not accept what we would have usually taken because there's such a large volume of submissions happening.
Yeah. Okay. And more generally at the Congress, is there anything in particular that you are looking forward to seeing at ACR 2020?
Oh yeah, ACR 2020 should be very good from the point of view of looking at quite a lot of few things that I'm interested in. So I'm interested in machine learning, and there's going to be quite a few abstracts discussed about machine learning to predict flares and to predict how we model the way that we treat our patients. And I think looking at all of them together might give us a way of looking at how things are going to go going forward, because our clinical practice has gone a lot virtual. And maybe using machine learning might help us to separate what we need to do going forward. There are some abstracts looking at, using drugs in diseases that traditionally we don't use them in. So looking at, for example, there's going to be apremilast in Behçet's disease, oral ulcers, etc. will be quite an interesting one to be looking at. That's a drug that's used in a different place. Using the small molecules again in psoriatic arthritis, etc. That will be quite interesting, and hopefully we'll be able to be looking at all of those and come out with maybe some new evidence base for what we'll be doing in the next few years.
Yes, yes, certainly the machine learning with the virtual clinics that we're doing now, very topical. And I was looking at the apremilast abstracts only earlier in preparation for the what we're going to find in the poster sessions later today, actually. So yes, thanks for going through your personal highlights with us. Great, thank you for joining us today, Dr. Bukhari, and thank you for watching Room Now. Don't forget that if you want to be kept updated during this very different ACR 2020 Congress, you can follow me on Twitter at Dr. Mrinalini Dey, and you can also follow the Room Now Twitter feed as well. Thank you very much for watching.